I think being an AHP in London is really quite unique in the sense that you're working quite closely with nursing staff, which is not an opportunity that I really had in Australia. So that gives you exposure to more holistic thinking. I love working as a podiatrist because it falls in that gap between medicine and therapies, and there's a little bit of both in that work.
The team that I worked with in A&E is a transdisciplinary team. It's a team made of OTs and physios. And what I like about that is essentially our job is making sure that person who does not need to stay in hospital gets home.
The rehab unit where I work, we have different type of patients come referred to us. Those who've had falls, fractures, with upper limb or lower limb, elective surgery, some spinal surgery as well. So the diversity in that is that every day is different.
It's been my dream because I was looking at a sector in the health field where science and technology meet. So for my field, we work a lot with machines and then using it in the medical field to diagnose diseases, it's like a match made in heaven for me.
Working in London can be difficult, but at the same time very rewarding in my opinion, because I think you're encountering more like difficult cases sometimes, like more complex cases comes to London.
I feel like London you get experience of every single type of person. It's a lot more diverse, you get a lot more experience with different cultures with regards to career progression and also with regards to experiencing different rotations. London has the bigger hospitals and the bigger trusts, so essentially you get a lot more opportunities in terms of rotations.
The experience that you gain from here, a different outlook on how you approach patients in terms of assessment, treatment, and the outcomes from it as well. It helps you grow, it helps you to aspire and have a vision to where you want to be.
You have choices, like even within London there's many options that you can go for. I mean, in terms of job roles, opportunities, there are loads of them.
NHS is more diverse and I would say it's more like bigger than what we have back home.
I started working in London as a band 6. I'm now a band 8. Within London and the NHS, you see the bands above you and you get to see that they're just normal people like you, and you sort of get to talk to other people. There's a lot more networking.
You can create your own pathway, and that kind of really spurred me on to find out a little bit more, do something different, and then have a kind of a vision to then go forward.
There's just so much to specialize in. You have CT, you have MRI, you have nuclear medicine, you have radiotherapy. If you're somebody that is hungry and you want to have more experience, my best bet is to move to the UK to work as a radiographer. So far, I've actually enjoyed my stay living in London. Yeah, because you never get bored, and there are so many things to do in London.
It's a pretty exciting place to live. There's always something to do in London. It's very touristy. Essentially, like right now, we just walk across from Big Ben and House of Parliament, just walking outside the hospital. You're the tourist attraction, really. You get the festivals here over the summer. There's always a lot of buzz. So I think it's a pretty exciting place to live. And you're sort of in the middle of it all.
My wife and I came through an agency, and we were intending to stay for 3 years. It turns out, obviously, we 23 years later, we're still here. And the reason why we stayed is that because we could be us. I could be free to be me.
With my background from Hong Kong, I'm quite a city person, I would say, and I really enjoy and thrive in working in London. You feel like you're always included.
I think I'm making a difference. I see the change that I make in my patient's life. Like, what I do matters to who they are at the end of the day, and I think that's probably why I still do what I do.
It just gives me that sense of being able to give back to the community, in whatever community that is.
What keeps me moving as a radiographer is actually the hunger to help people. When I take x-rays of patients, and then it leads to immediate diagnosis that will be able to save the patient's life, I'm usually overjoyed with that. So seeing that I can be able to participate and help in saving people's life. That's what wakes me up every morning.